this is the story, which is becoming more and more common, of a sophisticated doctor at age 34 or 35, or it could be a lawyer, a businesswoman, entrepreneur, who have spent their time getting an education and building a busy practice and never really found time to have a relationship that was permanent, and suddenly realize their eggs are declining and want to preserve their fertility. And they have to decide whether to do it, whether with ovary freezing or with egg freezing. This is her story. You're a successful doctor, a dermatologist, correct? Is that right?
Well, I'm a dermatologist, yeah.
Okay, but you're really busy. Let's put it that
very
way.
busy.
Okay, and you're too modest to say how successful you are, but you're busy, and obviously a beautiful woman. So there must be many men that would be interested in having a relationship with you. But have you just been too busy, or just didn't meet the right guy?
I just haven't met the right guy, I think. A combination of both, probably.
It's very hard if you're going to really be a busy doctor in training and then in a busy practice. How do you get a chance really to meet a variety of people, right? So you can find the right person. But really, you're part of this whole new world of women having opportunity to. They don't have to marry the first guy they meet at age 20 that might be okay, so they can be secure and have a family, right? I mean, you're able to get your BA and your MD degree and do your postgraduate residency, and it's a long residency, and then set up practice and really be a practicing physician, and that takes time. And so, how old are you now?
I'll be 35 in a week.
Okay, so you know what happens to your fertility.
The magic number.
That's the magic number, when you pass 35,
I chose the ovary because I work and I can't take 3 weeks off. And I just think it makes more sense for me.
And of course, with the IV, with eggs, I think I told you to be safe, you'd want to do 3 cycles of stimulation and retrieval. So it's more than 3 weeks off. And so it could be a 9-month process by the time you're done. Okay, so it's less convenient. Were you concerned about emotional swings from hormones?
Oh, yeah. I was not excited about doing any of the hormones.
So IVF, though it seems less invasive, in a way seemed more obtrusive to you, really.
Oh, absolutely, yeah.
So, but now freezing your ovary is surgery. What are your thoughts about that?
A little nervous. I've never had surgery before, but it seems like an easy procedure, and it's kind of like a tubal ligation in the sense.
Yeah, it's like a tubal ligation. Yeah, no more than that. And women don't think anything of that, I guess. And it will be. And of course, we've got this new anesthetic cocktail that'll make you pain-free for 5 days, and by then you're pretty much healed anyway. So it is surgery, and so the majority of women choose to make us freeze eggs, but when they hear about how easy it would be to freeze the ovary, they have their doubts and wonder whether they shouldn't have just frozen their ovary.
That's like it's kind of an insurance plan for me.
So you plan on leaving the hospital right afterwards, correct?
Yep.
Right, and then you'll be back to your busy practice?
45 patients on Monday.
Oh, 45! Oh my gosh.
Yeah.
I thought I was busy. So the whole idea of this is sort of summarize the advantage of ovary freezing, why you chose to do that over egg freezing.
Convenience, I think.
It's just more convenient.
Yeah. It makes more sense to me.
And I think it is invasive technically by definition, but it's really less obtrusive. Right? We expose a single ovary through a tiny little mini lap that is really no larger than the laparoscopy incision you would need to pull out an ovary. And we take out that single ovary, leaving your other ovary intact for the future. Many studies now have shown that unilateral oophorectomy does not reduce fertility, and in fact does not even bring on menopause any earlier than about 1 year earlier than would have happened otherwise. We leave the other ovary intact as a receptacle for transplanting this new frozen ovary many years later to preserve for fertility. We begin to resect thin 1 millimeter slices of ovarian cortex in preparation for ovarian cortex vitrification, which is a different technique. We use a special cryotissue microtome type device, which makes it very easy to get slices that are uniformly 1 millimeter in thickness, which is necessary for rapid penetration of the cryoprotectant and for rapid temperature drop of the ovarian tissue at 23,000 degrees centigrade per minute. You can see here from this histology that we're able to obtain virtually all of the primordial resting follicles in her ovarian cortex this way, and a slice that's thin enough not only to vitrify properly, but also to do a transplant, much like a skin transplant, that will revascularize very quickly without any ischemic loss in the future after thaw. We continue now to go through the entire cortex and find as many as 10 to 20 pieces of cortical tissue that we are now preparing in equilibrium solution, which is 7.5% DMSO and 7.5% ethylene glycol, and then place it in the vitrification solution that is 40% cryoprotectant, and wait until all of the pieces of tissue drop to the bottom of the test tube. Now that we know that all of the vitrification media is completely penetrated throughout the tissue, we place it on a copper grid and allow all the extra fluid to come off, and then, avoiding the Leidenfrost effect, we are able to dump it immediately into liquid nitrogen for rapid freeze at 23,000 degrees per minute. And then it is placed in closed storage using a Kitazato cryotissue closed storage system. The patient went home the very same day and over the weekend rested, and on Monday had a very busy medical practice. She had hardly any pain unless she did too many sit-ups, and 2 or 3 days later she was grateful that she had preserved her fertility, and she is back to her extremely heavy clinical practice without any delay and without having to go through multiple stimulation cycles. She's very happy, and it's a relatively pain-free procedure.